Could be that your blood pressure is too high, or maybe you have pain in your chest and your doctor prescribed you Bisoprolol, and now you wonder how you should use it. And this video is meant for you. We will cover how and when to use it, what side effects it can cause, what dosage you need, and much more. So make sure to watch the whole video so you don't miss any important information. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands, and it's my mission to medically educate you, my viewer. And remember, I'm just a random doctor from the internet. I know nothing about your personal situation, so always ask your own doctor for personal questions. Let's get learning. Which brings us to the generic name of this medication. It's called Bisoprolol and is available under the brand name Concor and Zebeta, available as a tablet. If you want to use it, just swallow it whole with half a glass of water and make sure to do so at fixed times. This will make it less likely that you forget a dose. Bisoprolol is part of a group of drugs called beta blockers. These reduce the workload of your heart, widen up your blood vessels, and cause your heart to beat slower with less force. Therefore, Bisoprolol can be used to treat a high blood pressure, pain on your chest, and chronic heart failure. Which brings us to the correct dosages to use. And here I want to mention that I can only provide you with some guidelines. Your specific dose will depend on the indication of use, the side effects you might experience, and severity of your symptoms. Therefore, always use the prescribed amount and frequency your doctor gave you. However, in adults, most doctors will start with an initial dose of 1.25 milligrams once per day for up to a week. If it is tolerated well, the dose might be increased weekly by 1.25 milligrams up to a dose of 5 milligrams once per day. From there, the dose can be further increased, if necessary of course, every 4 weeks with 2.5 milligrams, up to a maximum dose of 10 milligrams per day. Now, Bisoprolol is a very effective drug, but unfortunately it can also cause some side effects. I will discuss the most common ones in this video, but if you're looking for a complete list, ask your doctor, your pharmacist, or check your leaflet. Very commonly, it might cause a slow heart rate. Commonly, it can cause an increase in heart failure, dizziness, a headache or fatigue. Uncommonly, it can cause conduction disturbances or low blood pressure. Rarely, it can cause hearing impairment or an allergic reaction. And very rarely, it might lead to an increase of psoriasis, a rash, or hair loss. Which brings us to the safety of use. In the first few days when using Bisoprolol, it can lead to dizziness. If you do experience this, then please do not drive, as it can be dangerous. Furthermore, alcohol widens the blood vessels. It can therefore increase the side effects of dizziness at the beginning of treatment. Please try drinking alcohol in moderation so you can estimate its effects. Bisoprolol can also have interactions with other drugs you're taking, and it can be dangerous for those of you which are pregnant or breastfeeding. Always contact your own doctor and discuss these matters. I hope you now know how to use Bisoprolol, but if you have any questions, let me know in the comment section. I hope you did enjoy the video as well. If you did, click the like and subscribe button. It will help out your channel tremendously, and in return you will get a notification each time I post an awesome video. I want to give special thanks to Sebastian, who's a patron supporter, and for those of you that can't get enough, check out the Instagram as well, @howtomedicate. I will see you next week with a new video. Bye bye.